No.
Hello, my name is Mohammed. I'll be your nurse today. Today we'll be doing a quick assessment, but first I'm going to perform hand hygiene. Can you just please tell me your name and date of birth? Thank you. And let me check your ID. Alright, that matches. And do you know why you're here today? Do you know where you are? And do you know what day is it? Alright, thank you. I'm gonna raise the bed just so I don't hurt my back. Alright, that's good. So now I know that my patient is alert and oriented. So I'm gonna start with my assessment. I'm gonna start by doing this. I'm gonna check for Perlo, which is pupils equals round, resistant and light accommodating. And I'm gonna check both eyes to make sure that they constrict. They do. Alright, can you just follow my pen, please? Alright, and then just follow it. Thank you. And now I'm gonna check your ears, both sides. I'm gonna check for discharge. I'm gonna hold on the tray, press on the trachea, see if they feel any pain. Do you feel any pain? No? Alright. No discharge, skin is intact, everything looks good. Now we're gonna move on to the mouth. Lips are nice and moist. Teeth are nice and intact. Tongue is nice and pink. Mucosa is nice and pink. And uvula rises with noise when he says ah. So everything looks normal over here. Do you have any difficulty swallowing or any coughing or any earaches or headaches? No? Alright, sounds good. So now we'll be moving on the heart, listening to the heart. Alright, so first we're gonna start at the aortic, and now the pulmonary, and then herbs, and then tricuspid, and then mitral, which is the same as the apical pulse, so I'll be listening to this for a minute. Alright, everything sounds good. Actually, now we're gonna listen to the lungs. Alright, so now we're gonna do the ladder movement. So we'll go like this. Can you just give me a deep breath every time it touches your chest? Alright, thank you. And we'll be checking the lungs posteriorly as well. And we'll also be checking it laterally as well, on both sides. Alright, are you having trouble, what's it called? Do you have any trouble breathing? Any respiratory issues? No? Alright, sounds good. So now we'll be moving down to the abdomen. First, before I touch or anything, I'll be inspecting, making sure all the skin is intact. No lesions or anything, and everything does look good. So now I'll auscultate. We'll start with there's 4 quadrants, so we'll start with the right upper, right lower, left upper, left lower. Alright, and I'm hearing for active vowel sounds. Yeah, and then now I'm gonna palpate. Alright, everything feels good, no abnormalities. So now I'll be checking the genital area. I'm gonna check for any discharge, for any abnormalities, any skin infections. Alright, so everything does look normal here. So now we'll be going up, back to the chest to assess for hydration. So I'll be pinching on the skin. I'll be pinching on the skin for skin turgor. And we need to make sure the skin recoils back to make sure that there's to know that the patient's nice and hydrated. The skin does go down. And now I'm gonna be checking the radial pulses, both at the same time. Make sure there's equal rhythm, rate, and force. The rate is 70. Alright, those feel good. We're gonna check for edema in the arms. We're gonna check the skin condition in the arms. Everything looks nice. Now we're gonna move on to the lower extremities. First we're gonna inspect the skin, make sure everything looks nice and right. We're gonna check for edema on both legs. Check the skin condition posteriorly on the back of the legs as well. Make sure everything is nice and good. We're gonna assess for the capillary refill. Oh, and I don't know if I assessed the capillary refill on the hands, but I'll just say that just in case I didn't. Make sure that the oxygen comes back. We're gonna do that for the toes as well, both sides, and as well for both sides over here. And now we're gonna assess the pedal pulse, and then the posterior tibialis pulse. All right, everything. The rate and rhythm feels good. We'll be covering you back up. Now we're gonna perform some range of motion exercises, but first we're gonna assess for strength. So can you please push on my hand like it's a gas pedal? All right, thank you. Now can you point your toes to your nose? Good job. Can you squeeze my hand, please? His grip is nice and strong. And now can you just imitate me and do the range of motion exercises I'm doing? So first there's circumduction, flexion, extension, abduction, and adduction. And so you're done with the, sorry, I almost forgot, and supination and pronation. Sorry, I almost forgot. All right, and then, so I'm done with the range of motion exercises. Everything feels nice and good. We're done with the physical assessment. Make sure the call light is by you, and then we're gonna lower your bed. And if you need anything, just hit the call light and I'm here to help you.